RISES is made up of a number of research groups and exchanges. One of those is the Cardiovascular Health Science Research Group. It's something that has been working here in the Research Institute for about 15 or 16 years as a cognate group. It combines a number of elements of cardiovascular work. Some of it is very population-based in terms of looking at cardiovascular health benefits with exercise. Some of it is very focused on scientific evaluation, looking at vascular physiology, how the vessels respond to exercise training and disease. Some of it is related to the heart specifically in terms of cardiac structure and function. But the overall picture is trying to gain a clear indication of how the cardiovascular system benefits from individual bouts of exercise, but also potentially years and years of training in very, very different population groups. One of the things that we're very interested in determining is how exercise helps that across the lifespan. So we're interested in work with young children, keeping them physically active and making sure that their health is as optimum as it can possibly be as they go through the growth spurts into early adulthood, and get all of those positive lifestyle choices in place before they become an adult moving out of school, out of university, into the workplace, where often our physical activity levels drop. Get people as fit and healthy as we can for as long as we can, understand the value of exercise for the heart and the vessels. Even to the point in later life when you become 50, 60, 70 years old and lifestyle diseases do take hold, then exercise is even more important, both in terms of the recovery and the prevention of further health problems. So it's definitely a lifestyle and a lifespan issue of having the engine, the heart, and the wiring, all of the tubes, working properly. My focus as a researcher is looking specifically at the heart, how the heart responds to acute exercise, but also how the heart responds to years and years of training. And there are a number of different ways in which those research areas will be applied. So we are interested in the athletic heart. You know, if you are an elite athlete and you've been training for 20 years, what does your heart look like? And there are some very important questions about how you differentiate the athletic heart from diseased hearts, and you prevent people from having major cardiovascular events. In an acute setting as well, we're interested in how the human body can cope with some often phenomenal amounts of exercise that people undertake when they run a marathon, when they do a triathlon, when they run for 24 hours non-stop. Is that taking the heart beyond the benefit of exercise, or is it taking it into a position where it might be struggling to cope with the imposed work? Those sorts of issues are applied to young and old, they're applied to the elite athlete, all the way through to the clinical population. I mean, a lot of our work is interdisciplinary. We'll work with people from a health perspective, from a physical activity perspective, potentially from a nutrition and muscle metabolism perspective. When you're trying to solve some of these issues facing 21st century society in the UK, you can't really afford to try and address it as a single discipline problem. You know, getting people to exercise and having a healthy heart, part of that is about assessing whether they have a healthy heart, but part of them is getting them into a psychological place to actually perform the exercise. So I think one of the values of the Research Institute is it allows all of the different domains, the psychology, the sociology, the biochemistry, the biomechanics, all of those people to talk together, to live together and share their experiences and ideas.